And what could a parent do as far as if they're faced with this situation and they're getting the pressure from, doctors and, other authorities are saying, this is what your child has wrong and this is what you need to do and get them on medication. What could a parent do first before she or he goes down that road to just jump on the bandwagon of seems like what everyone else seems to be doing?
Right. Well, I think the first thing a parent should do is become an advocate for their child. And I think that sometimes that's really hard. And I really want to validate how hard this can be, that if there's, a person with, a big sounding name and a fancy label saying you have ADD, that it's hard to, say something different, or if a teacher is convinced that this is what's going on. But begin advocating by saying, well, I've noticed that my child has these gifts, and this is what is very good about them. Now, the one thing that I see several times a week, which is it infuriates me, is some of, highly respected, well-trained professionals who are giving these very elaborate tests, and they'll come down with a diagnosis of ADD, and I will, carefully review them, and what I'll find is they may have some of the symptoms of ADD, but there is no impairment in functioning. And so what we know is that in order to make the diagnosis, the number one criteria is that there's an impairment in functioning. So if your child is doing okay in classes, if they're getting their grades and they're getting satisfactory on the behavioral things, that's not an impairment in functioning. So what I'll see is these kids that, they're getting diagnosed because they have some of the symptoms, and the diagnosis process is so sloppy. So what I want to say is take it with a grain of salt. Even if they're doing average, well, some people in the world are going to do average, and it may have more to do with there not being a great fit with the educational system than with anything else. I think an involved parent who makes sure that the teachers and everyone involved knows all of the gifts and all of the strengths that their child has, and advocates for an approach to build on those strengths is going to buy themselves some time. And I do think you should get support from a therapist or someone to just make sure that if there's any anxiety or depression in the child, that can actually look a lot like ADD and show up as a diagnosis of ADD when the root cause is depression or anxiety. Mm-hmm. So addressing those underlying issues, finding a strengths-based therapist is something I really advocate. So those are some first steps. And there's, of course, there's many other things too.